Hippocrates, the father of medicine, said, "Look to the spine as the cause of all disease." Thomas Edison said, "The doctor of the future will give no medicine, but will interest his patient in the human frame and diet and exercise." These were two pretty profound men in history, inventors, scientists, doctors. And today, moving forward few hundred years, we have this profession called chiropractic. And it is based on the fact that the body has an ability to self-heal and self-regulate. And the way that it does it is through the nervous system. We live our life through our nervous system. Your body doesn't know the difference between reality or your perception of reality. And so your body will respond and react accordingly. Now, a lot of people have asked, why the spine? What's so important about this thing? My back doesn't hurt. And, you know, I'm sure you've seen a lot of videos of people holding the spine and talking all this great philosophy, but we're going to just break it down and explain it as simple as possible so that everyone gets it, okay? Yes, we were all born with this spine. It is the first thing to develop the nervous system in utero, 7 minutes. And then it controls and coordinates the function of every other system in the body. And as we develop, as we're born and as we develop these spinal curvatures. Now, when we look at the side of the spine, we can see, so there's 24 movable bones in the spine, there's 23 discs in between, and we got these nerves or power lines that exit out. So the brain is sitting up here. The brain is actually an amazing organ. It takes organic matter from the food that we eat and it converts it into electricity and mental impulses. It then sends signals down the spinal cord, exits out these nerves, and controls and coordinates every function in the body, either directly or indirectly. In over a decade of seeing patients and treating patients, I was not the first doctor that they had seen, nor the first chiropractor. And while people would come in with a myriad of symptoms, not just neck and back pain, they would come in with colitis, reflux, heart issues, digestion issues, sugar handling problems, thyroid issues, sexual dysfunctions, breathing, palpitations, asthma. You know, you can list it symptom after symptom after symptom. And the issue is that the body, as we said, is designed to be self-healing, self-regulating. It's designed to be in balance with homeostasis. They don't want you to know this. They want you to think that you are sick and your body is stupid. Now, let's talk a little bit about this. Fred Barge, chiropractor and chiropractic philosopher, talked about one cause, one cure, that the one cause of all disease is the body's inability to comprehend its internal and external environment. And the one cure of all disease is the removal of the obstruction to healing. So if you're a psychologist, you remove the mental obstruction. If you're a surgeon, you remove that physical blockage. If you're a chiropractor, you're removing that nerve interference. And regardless of your healing art or profession, the idea is remove the obstruction. If you have surgery, surgery is not the thing that's healing. Surgery is removing an obstruction. It's still dependent on your body's ability to heal itself. Okay? So with that philosophy, when there is an obstruction in the nervous system and it starts to produce some sort of malfunction, that malfunction creates symptoms, and those symptoms are labeled as disease. And now what do we have? We have a new disease of the day. So as soon as I label a disease to you or anyone out there, then I have labeled and branded you. If you look at commercials, drug commercials, you have to sell the sickness before you sell the cure. So if you are watching any drug commercial, what's the first thing they're going to do? They're going to list a bunch of symptoms. Do you have stress? Do you have high blood pressure? Do you have itchy butt? Do you have big toe inflammation? Do you have vision problems? So they'll just list a bunch of symptoms. And then they'll say, well, you have this condition. And now you've been branded because in your mind you see these symptoms. I have it. I have that condition. Now I can sell you a cure. Okay? And the idea is I'm not fixing your condition. I am branding you to give you something that will minimize your symptoms without fixing it. Okay? And that's the idea. And as long as I get you on something that will minimize your symptoms, you think you are healthy. And this is one of the big issues in our society today. That everyone is looking for a magic pill, a magic procedure. They're looking for that tangible thing that's going to make them healthy again. And my friends, you are and have the ability to heal and be healthy. It's just about removing the obstruction to healing. So yes, neck and back pain is why most people go to the chiropractor. But we want to go a little bit deeper now, okay? And we want to go deeper into the physiology without using too many big words, but just demonstrating some examples. And when you look at the nervous system, we said the nervous system is the most important system in the body. It controls and coordinates every single function. They actually have showed that the brain communicates with every single cell in the body 100 times a millisecond, so it's always communicating. They've also found in the research that 90% of the nutrition in the brain that the brain receives is through movement of the spine. So if there's a joint that's stuck and there's lack of motion, you're losing nutrition to the spine. There's two nervous systems, actually there's three nervous systems. We're going to talk about two basic ones. There are the spinal nerves, the spinal nervous system, that's represented here in this chart, or the peripheral nervous system. These are the nerves that control the joints and the muscles and the tendons and the ligaments and all the external functions of the body and movements and posture of the body. They actually found that when you take a cross-section of the spinal cord, 85% of those fibers are responsible for posture. Okay? So your posture is also very important for your health. Now we're going to go to the next chart, which represents the autonomic nervous system. And the autonomic nervous system is the system that as the name says, is automatic. It controls all your organs. Our breathing, our heart rate, our sugar levels, our adrenals, our digestion, our pancreas, all of the internal functions happens without us knowing. Okay? It just happens automatic. And there have been people over the years that have identified primary nerve supplies to these organs. Now within the autonomic nervous system there are two parts. There's the sympathetic nervous system, which is your fight or flight, and there's the parasympathetic nervous system, which is rest and digest. So when your sympathetics kick in, that's the excitement, that's the energy, that's the let's pull blood to the skeletal muscles, let's run, let's breathe heavy. The parasympathetic nervous system slows everything down. So we have sympathetic nerves speeding things up, parasympathetic nerves slowing things down. And now if you look at disease and you look at symptoms and you look at conditions out there, everything out there is one of two things. It's too much or too little. That's it. You either got too much of something or too little. You're either toxic or deficient. And every drug out there, regardless of classification, is doing one of two things. Inhibit the hyper or stimulate the hypo. That's it. And guess what? ladies and gentlemen, the nervous system does that. The autonomic nervous system does that. Now there's a third nervous system that a lot of people don't talk about. It's called the enteric nervous system. The enteric nervous system is in the intestines. It's in the gut. It's, if they took all the cell bodies in the gut, it is equivalent in quantity to the number of cell bodies in the brain. And it's that whole, you know, people talk about that gut feeling, right? There's actually a lot of truth to that. And it should now be evident that you do not just see a chiropractor for neck and back pain. You don't even see a chiropractor if you have pain. The idea is we want to check to see, is my spine in alignment and am I free of any nerve interference? And chiropractors are the only professionals that are able, healthcare professionals that are able to detect, locate, and correct if there is any nerve interference. So patients that come to us here in this office, they start with a serious condition. We get those issues corrected and then we check them periodically. It's like you go get your teeth checked, okay? You go to your dentist, you make sure there are no cavities. Well, the subluxation is like a spinal cavity. You don't see it right away. When you take a cross-section of a nerve root, there's less than 10% of those fibers are actually sensory pain fibers. So you can have a misalignment, you can have nerve pressure. That pressure could be irritating organs, and you don't have pain with it, but it's still there. You can have a cavity, and there's no pain. So the idea is to get regular spinal checkups to see, are you clear of nerve interference? And people ask me, how often do you get adjusted? And if we go historically, Dr. Gonstead was not, you know, they teach us that he wasn't really about wellness. He passed away in '78, so I didn't have the fortune of actually meeting him and experiencing his adjustment. But I was fortunate to learn and train by the doctors that he taught. And his whole philosophy in chiropractic was find the subluxation, accept it where you find it, fix it, and leave it alone. And what he meant by that is leave it alone. Once you fix the nerve pressure, don't mess with it. Give the body time to heal. And I've heard stories, people going as long as 22 years without an adjustment. That's in a perfect ideal world. In today's society, you know, 30, 40 years later, we live sedentary lifestyles. We have postural issues. We don't exercise as much. We're on the computer. We're on our phone. We're texting. We're on the, you know, we're on our iPads or our tablets. And the reality is we have a lot more stressors on our body today, number one. Number two, we have a lot more perception of stress today because of the media and because of societal pressures. So a lot of times we walk around, something is off, our perception is off. We don't even realize that something is off. And then a symptom gets expressed. We go to the doctor, gives us a pill. Hopefully it helps. If it doesn't, come back in 6 to 8 weeks. That doesn't help, give another pill. That doesn't help, give a third pill. That doesn't help, it's in your head, go for a psych eval. That's typically how things work. So people ask me, how often do I get adjusted? Now, I was in several car accidents. Actually, I was in 10 car accidents growing up before I got into chiropractic college. So I had a lot of spinal issues. I'm not just the doctor, I was a patient. I am still a patient or a client of chiropractic. And in all those 10 car accidents, I may have seen a chiropractor, some acupuncture, massage therapy, but no one really ever explained anything to me. No one told me this is what's going to happen and these are the detrimental effects. So a lot of it was go in, get some care, and close out the case. That's really what it was. I was a patient, I'd been in so many car accidents, I'd been to chiropractors, but it wasn't until I got into the Gonstead methodology that I really understood and saw the results of specific hands-on adjusting and what could happen with that. So I initially started, and my story was, I was going 3 to 5 times a week for over a year and a half to get my curves back, to stay in some sort of alignment. And now I'm in chiropractic college, and it's a hands-on, it's an athletic event. This is not just you need to have all the knowledge of what the MD knows, but you need to know all that, and you need to use your body to help the patient. After all that year and a half of all this care, then it started to taper down. I get checked once a week, and it's, you know, we're not adjusting 7 things. And there's a thing in the profession, we call it the flying 7. You get rolled on one side, crack. You get rolled on the other side, crack. You go face down, crack, crack, crack. You go face up, twist, twist. 7 adjustments, 7 cracks, flying 7. There was no analysis. There was no instrumentation. There was no mechanical thought to the adjustment, because there is a biomechanically correct way to adjust the spine to minimize the stresses and minimize the damage. And the Gonstead work, which I love and I teach and I promote all over the world. Why? Because there is a specific system of analysis to detect correct the subluxation. That's really what this is, to keep it really simple. We find the nerve pressure, we correct it, and we say go walk for half an hour to an hour every day. Let your body realign and readapt. And then if we need to, we go through some postural corrections to look at your overall posture and your lifestyle and see what are the things that are out of balance in your life that we can help get back into balance.